Hi there, welcome to Ask the Chiropractor, your source for health, healing, and chiropractic-related information. My name is Dr. Adam Rodnick, chiropractor out of Commerce Township. We have two wonderful guests with us today on the show. We have our returning guest, Dr. Will Kelly out of Ann Arbor. Glad to have you here with us today, Doc.
Thanks very much.
And we have our special guest today. We have Lori Faitel with us. She's an occupational therapist and renowned author and traumatic brain injury survivor. So great to have you here with us today.
Hi, Doctor.
So I want to spend some time here talking to our audience about your experience, about your amazing story of how you had your traumatic brain injury and how you survived and how you came out of that.
Well, I'm a traumatic brain injury survivor. When I was 24 years old, I was driving to work one beautiful spring morning, and a truck dropped bales of hay onto my windshield. 1 in a million. My car rolled and went off to the side, and I hit construction, and my car was smashed. The police said that they had to pull me out of the car with jaws of life. An ambulance came and got me and took me to the hospital. On the way to the hospital, I guess I died twice. And then once I was admitted in a coma for 7 days. Lots of therapy, lots of personal work. Took me about 6 years, and then I felt ready to come into the world of the non-brain injured again.
That's a very, very tough story. It's the 1 in a million. That's like what people always hope will never happen, never expect a bale of hay to fall in their car. And it's amazing that you're with us here today.
Yeah, I'm so happy.
And that you had, such great results. So in the beginning, after the brain injury, you had a lot of trauma. It took you a lot of time to come back into the regular world.
Yeah.
Now you had a lot of emotional disturbances because of that also, is that?
Yes, well actually, I guess right after the insult, my brain injury, like I said, I was 24 years old, and I guess my functioning of my brain was that of a preborn child. So my brain had to learn from before birth to that of a 24-year-old while I was in a 24-year-old body.
You had to catch up, right.
Mm-hmm.
So it took time. So over time it took years for you to actually progress to catching back up to your age, is that correct?
Yes, yes. And I had a lot of pain. I'm blessed that nothing in my body got broken except for my brain. But I felt a lot of pain all through my neck, headaches all the time. I had to learn how to walk and talk and do everything again just like a baby. But again, I was in my 24-year-old body. So I was insecure and nervous and didn't know if anything was right and always felt like I was wrong about everything. So I hid myself, and I didn't want to get out. Yeah, right. And I didn't want people to look at me as a...
Almost felt embarrassed, and it's a very stressful situation. But and look at her today. She's here with us. Mm-hmm. She's living a wonderful, normal life. It's amazing.
I'm blessed. Yes, thank you.
Now I know you're very heavily involved in the Brain Injury Association, and through that we see how common brain injury actually is compared to what most people think.
Mm-hmm. I remember reading on the brain injury website that the instances of brain injury per year are 6 times more than multiple sclerosis, HIV/AIDS, spinal cord injury, and breast cancer combined.
6 times more likely to have brain injury than any of those other conditions, which you hear a lot more about than you do from traumatic brain injury. And I did see the same statistic, and that statistic, the 6 times more likely, is not even talking about military damage. Yeah. People that had brain injury from being in war or through the military, anything like that. And I know that that's very common too, that people that do go overseas, that are in war, mm-hmm. or veterans, they absolutely have a better chance of having brain injury than anybody else. And I know, Dr. Kelly, that's something that you see a lot, is I know that you see a lot of patients through the VA.
Mm-hmm. See a lot of people through VA. I mean, I've had a huge experience, even as a student. I've had people come in with brain trauma, and they tend to have it almost like, I don't want to say garbage can diagnosed, but it's almost kind of garbage can diagnosed under post-traumatic stress disorder. And actually, when you start looking closely, a lot of the neurological signs of people. It's not just that they're stressed out. There's actually some trauma to their brain, unfortunately.
Absolutely, and I've had the same thing. I've had a lot of veterans also that I've taken care of under my care that have had traumatic brain injuries from everything from grenades to Humvee accidents to bullet wounds to you name it, and they've had traumatic brain injuries due to that ultimately impair their function, impair their healing, and also cause them chronic pain. And that's usually really the first thing why they come to see us is for the chronic pain. But then they realize later on down the road that we actually can help their stress level and through chiropractic care help their overall brain function, help the overall connection from the brain through the spinal cord and down through the body.
Absolutely.
And isn't it true that it's not even something major? Sometimes a mild concussion can cause all kinds of brain problems.
Absolutely, it sure can. Now, mild concussions, we can even see things like hematomas. We can see things, hemorrhages in the brain, things like that. Now, our brain is surrounded by our skull. Now, if something, even a mild concussion hits just the right angle, just the right amount of trauma, can cause the side of our brain to scrape up against the wall. And we can see, dozens of different disorders, specifically due to even minor conditions, minor traumas like diffuse axonal injuries, which is where the delicate nerve fibers around the brain can actually damage, rip, or tear. We can see swelling, where the brain is swollen due to which prevents blood from coming in, and cerebrospinal fluid, which is actually the fluid that helps to nourish the brain and spinal cord. We can see things, anoxia and hypoxia, where we don't have normal oxygen, and it actually starts to suffocate the brain. Now, these can come, again, from the traumatic major injuries like the type of injury you had yourself, or even from a little less minor. We see them from, the number one place we see them from is from car accidents. We also see them from domestic disputes, things like that, from people fighting out in the community. We see them, again, like I said, in the military, all sorts of things. Bicyclers, absolutely, and that's why it's so important for people to wear their helmets. A lot of children think it may be silly to wear their helmet, but from the percentages that we see and from how traumatic a head injury can be, absolutely important for children to wear their helmets and things like this. And so after your injury, for years later, I want you to let our audience know how you developed into having chronic pain and the headaches and the neck stiffness and all these things, and how it started to, because you had the traumatic injury, started to, over time, lead to arthritis, and the damage progressed.
Well, I remember when I first started, well, not when I first started, because I don't remember anything from when it first started, but as years went on, I would say to my physical therapist and my neuropsychologist that I had pain in the back of my neck, and they did ultrasounds, and they said, well, nothing's broken, and stretch and do this and do that. And now it's been 24 years, and I'm a certified occupational therapy assistant, licensed here in Michigan, and in my job I work with people like I'm talking to you, and I'll help them position themselves, and I always make sure their spine is nice and straight. And when I'm moving, even after working for just a half hour, I get a lot of pain in my neck. I was helping a patient a couple years ago. I was helping her transfer. That's the main thing that occupational therapists do, is teach people how to move, like from their bed to a wheelchair. I helped a patient move from a wheelchair to a toilet, and she fell. And to pull her up, I yanked on whatever doctor, and it hurt me so bad. And when I went to a sports therapist, he took all the x-rays and said I have arthritis in my neck, which I'm only 48, and I've got it.
Way too young to have all this. And now I want to get into a little bit about how arthritis and degeneration in the spine, bone spurs, osteophytic formation can start to form directly due to a trauma in the spine from years before. Kind of like this, if someone's to think about a car that's out of alignment, we know what happens to the tires. The tires start to ball, parts start to wear out faster than others. And the more you drive around that car that's out of alignment, the faster it starts to wear out, the faster it starts to degenerate. And so just a minute, in a couple minutes, we're going to roll a video clip that actually shows the degeneration cycle as it progresses in the spine. So as the spine goes out of alignment, severely out of alignment, from something like the injury that you had, a severe brain injury and a severe whiplash, we have ligament laxity, where the ligaments actually tear and they actually shear and they actually become loose. And so they heal wrong. And so when when it's severely out of alignment like this, just like your car out of alignment, the tires start to wear out very fast, the tires start to ball, same thing happens to the body. And so those bones and those joints, the disc spaces in between there, and the bone is what we call osteophytic formation, or bone spurs. Actually, bone deposits start to form into the bones. And in just a second, we're going to roll this video clip, and I want to show our studio audience exactly what it looks like as it starts to degenerate. And that's what early arthritis is. Arthritis basically means, the word itself, arth is joint, itis is inflammation. So it's the swelling in the joint, but when it actually starts to degenerate. That's really all that arthritis is degeneration of the spine.
Mm-hmm.
And so we're talking about osteoarthritis or degenerative arthritis.
Mm-hmm.
And so the more severely something is out of alignment, over years it starts to degenerate. And when a certain part of the spine, when we look at the lateral view or sideways view in the cervical spine, when that curve is reversed, we know that the spine degenerates at 4 times the rate that it should. So if we could roll that clip there where we show the x-rays. Now here we can see the normal curve in the spine. We're looking at the side view. You see on the back side here, we see the back of the skull, and we see the jawline in the front. And see over time, if the spine starts to reverse here, we want to see, look at the bottom few vertebrae here in the neck. See the spurs starting to form on the very front. We see little spikes.
That's all the
Osteophytic formation.
fuzziness?
That's all the fuzziness, exactly.
Okay.
That's the osteophytic or bone spur formation. And we see the disc spaces over time now start to degenerate. They start to get smaller and smaller. So here we go. We're going to run it again. Here's a normal, healthy curve. When it's in this healthy curve position, we're able to send neurological impulses, signals through the spinal cord and brainstem normally. Here it straightens out. When it's fully straight, they call that military neck. Now it's reversed, or called kyphotic cervical curve. When we're in this kyphotic position, right here, now when it's in the kyphotic position, it degenerates so fast. Here we see it degenerating much faster rate. See the disc spaces come together.
Yeah.
We see the bone spurs in the front, on the bottom. Let's run it one more time here. So here's the normal position. As we start to lose this normal arc, or cervical lordosis, which I like to nickname the arc of life, we start to lose the arc of life. Here's it reverses right now. You'll see it start to degenerate, and the discs come closer together. Start to degenerate here.
And people don't feel that change.
And a lot of times people don't feel that change because it's coming on so slowly.
Okay.
And the way that these joints work is the way that they get the good things in, like water, nutrients, minerals. And that was a wonderful clip. I really did enjoy that. I'm glad that we showed that here. So we can come back to the studio here. So when they get the good things in, water, minerals, nutrients, come into those discs, into those joints with proper motion, when we're able to move correctly.
Right.
But when the bones get locked up, when we start to have reversed curves, things like that, the good stuff like the water and the minerals and nutrients can't get into those joints and discs, and the bad things like scar tissue or inflammation or cellular debris isn't able to leave the joint or leave the discs.
Okay.
And so when that happens, it's kind of like a sponge without getting normal fluid to it. You know, you can take a wet sponge and put it in the road and someone can run over it, no big deal. But if you take a dried out sponge and run over it, that doesn't sound good, right? And that's exactly what starts to happen when we see those discs degenerate at that accelerated rate. And Dr. Kelly, I know this is something you see regularly in your office. You see the degeneration cycle, and you see people that don't necessarily even know they have the problem until we take a look at it.
I do. It's, you know, one of the biggest misunderstandings I find is people's understanding of arthritis. You know, they talk about it like, yeah, I got arthritis, my mom had it, like they got dealt a bad batch of genetics. And if you start looking at the information, they only attribute about 25 to 30% related to genetics, like you said with your car, you know, not checking the alignment, keeping, you know, 20 pounds less tire pressure on the right side of your car and calling it degenerative tire disease 20 years down the road. It really, I mean, it really comes into just, you know, poor alignment over time, hence arthritis. And, you know, it's, unfortunately, people have a misunderstanding about it that I see every single day. That's the most prominent thing I would say.
And another misunderstanding I see a lot of people have about this arthritis in their spine, anywhere in the spine, but specifically the cervical spine, is a lot of times they'll come and they'll say to me that they have this arthritis. You know, they've been diagnosed and someone told them that they have arthritis in these specific vertebrae. And they think, well, you know, I'm getting older, so of course I should have some arthritis now. But then we take a look at their spine, and why would they have it in 1 or 2 specific vertebrae and not the rest of the spine? Their whole spine's the same age, their whole body's the same age. Why would it be in one specific area? And the answer, the reason is because that's where they've had the most trauma or the most misalignment over time. And so, of course, with your injury, where you've had the severe whiplash to your neck, where you had the brain injury, that's where you've seen the most arthritis start to occur because it's been severely out of alignment for such a long period of time.
Okay.
Now, it's shown that after you have severe whiplash like this, where it's twisted the wrong way, every 7 to 10 days, a tiny microscopic layer of scar tissue forms around the joint. And so what we see is such a big mistake so many people make with their spine and their health in general is they'll have like a whiplash type injury or head injury or trauma, and they won't take care of it for years and years later. Now, years and years later, they have more arthritis. They have more scar tissue built up. They have more trauma than they did originally. So we always recommend to people that if they have some sort of a trauma or injury, a motor vehicle accident, they get their spine checked immediately. Want to get it checked as soon as possible. You know, don't get me wrong. Absolutely, if they're hemorrhaging, don't come to the chiropractic office. Go right to the ER. Go right, you know, take care of that first. But once they're back on their feet, once they're out of the hospital, once they're able to come into a chiropractic office, that they should absolutely get that checked right away to help prevent more degeneration along and help prevent more scar tissue.
So when you come and you give me adjustments, or when I come to you and you give me adjustments, then that's helping the nutrients between my
Absolutely.
vertebrae?
As we can restore normal motion to the spine, and as we can take some pressure off the joints, and specifically on the nervous system. We know that the nervous system controls and regulates every function of the body. So if we can release some pressure, really get more nerve impulses, which then can lead to more blood flow, more lymphatic drainage, all sorts of normal functioning restoring there, absolutely helps to get normal fluid back there, helps to get normal nutrients. Now, because of the severe level of degeneration that a lot of people come in with, can we, you know, turn someone's spine that's, you know, 75 years old with arthritis in it into a teenager spine? No, they have some very serious and very permanent irreversible damage. Can we help that person? Absolutely. Absolutely, we can increase their nerve impulse, increase their total overall performance, increase their ranges of motion, increase the way that the body functions, increase, of course, how they feel. You know, we know that, of course, we help so many people with chronic pain, but more importantly is the function. And what we can absolutely do is prevent that degeneration from setting in and accelerating at such a rapid rate. If we can catch it, especially early, like I said, when it's to reverse like that, it will degenerate at 4 times the rate that it normally would. So if we catch it early enough, we can prevent so much degeneration, so much arthritis from setting in the long run.
Well, I know that oftentimes I come to see you after I've been working and I have pain. Specifically this past winter when I was driving and I had to make a left-hand turn, which I hate. And so my head, I was going back and forth and back and forth, and it hurt. And after that, in driving, I had to move my whole head, my whole body to turn. And I came and saw you and you adjusted me and I felt comfort right away.
Absolutely. And when we looked at your spine, we saw the level of degeneration arthritis, just like you had been diagnosed with before you came to see me. And again, the reason that was there is because of the traumatic injury that you suffered, and thank God that you survived and are here with us today. But because of that, over time, it started to degenerate at this rapid rate. And so as we started to work on it, we were restoring normal nerve flow, normal blood flow. And even just in a few visits, if you could tell our audience, you know, your experience with our office, that as we started to make adjustments, immediately you noticed more range of motion, and of course decreasing the chronic pain.
I slept better, took less extra strength Tylenol to go to sleep. Yeah, oh, that was great. So the 24-year gap between when it initially happened and the doctors didn't find anything, and now I feel so much pain.
And now a lot of times when they look at it too, when they're looking for it, especially right after a trauma, they're not necessarily looking at the alignment. What they look for right away is fractures.
Okay.
We're looking for things that could, you know, end someone's life immediately. They're looking for burst fractures. They're looking for, you know, fractures in the top couple bones in the spine or in the skull where it could actually cut right into the brain stem, the spinal cord. And so a lot of times they'll let people go and say that, you know, they're okay. Meanwhile, they do have this severe whiplash or misalignment that isn't being addressed a lot of times until much later. That's why it's important to go and make sure to get medically taken care of. Go to the hospital. Go to their regular family doctor. Go to urgent care. Go to whatever, and make sure there's no fractures and traumas and things like that. But then it's important to go afterwards to their family chiropractor to check for misalignments and to start correcting those right away. Now, over time, did you notice a progression? You know, you obviously had the headaches, and over time, years and years as it started to degenerate, those became pretty chronic and pretty frequent. Is that correct?
Yeah, they changed. The initial headaches, I'm sure, were from brain injury. It was a pain that I never knew before. And now, and as it built, or as time went on, the pain that I felt, for the longest time I thought it was just my trapezius, and I thought it was just because I was lifting and pushing. And I had therapy coworkers, give me massages, which gave me comfort in the short term. So Yeah, I did notice pain, and but I didn't even, I know occupational therapy, and I work with physical therapists, and we didn't put it together.
And a lot of people do that. A lot of people just go through the one path, you know, and they never hear that they should see a chiropractor or never hear about chiropractic in general. And so sometimes it takes them, you know, a little longer to find out about it. So that's why it's important for us to get information out there to people that we can help prevent some of this degeneration, and we can help people with chronic pain, and more importantly, help their nervous system to function at a healthier rate. And so what kind of changes did you notice since you started under chiropractic care as far as those headaches go?
They've gotten better. I still have headaches every day, and I know that when I come in to see you, I fill out a form and I give a pain level, 0 being nothing and 10 being unbearable. I know because of what I've went through, my pain threshold is huge. I can handle a lot. So it never goes to 0, and it probably won't. But I remember when I came to you, I easily would document 7s and 8s. And the last 2 times I came to visit you, I was putting 1s. So.
Which is amazing, which is great. Out
yeah.
of scale from 0 to 10, from 7s to 1s is amazing, especially at the level of headaches. You know, it'll probably never be a consistent 0 because of the chronic injury, because you had such a severe injury before, but we can absolutely maintain it and keep it as good as possible.
It makes a big difference, and oh my goodness, I love being able to sleep. Thank you.
Which is awesome. And that's a big change that we see a lot of people have as they start to go through chiropractic care. Isn't that right, Dr. Kelly? That changes in their sleep is usually one of the first changes people notice.
Oh yeah, one of my favorite studies, it was from the late 90s. They gave someone a Nobel Prize for brain research because he basically proved that the less mechanically distorted or your spine is, the better it moves, the more energy you have for thinking, metabolism, and healing. And that's the first thing. When people come in, they always talk about, you know, pain, and then within the next few visits, they come in and it's like, okay, you know, I don't have allergies as much this morning, or I slept for the first time in, you know, months, like a full night of sleep. And it's like I tell people, yeah, your body's working more efficiently. If your spine is stuck, just standing up against gravity, your body has to use way more energy just to kind of use other muscles to keep you going. And so as you start moving the spinal joints and everything works more efficiently, you just have more energy. It's math, essentially.
Absolutely. And I have a study here. Now, I know we were talking about with the Brain Injury Support Group. And before I even get into the study, I want to go back into, we were talking about how you're a member of the National Brain Injury Association and how you've written a book here that's, you're a renowned author about your experience with brain injury. So we could show her book here. She wrote a book, and the name of it is Am I Brain Damaged? And it's about her experience through her recovery through brain injury. And it's important for her to get out to these associations. I know she's a renowned speaker in a lot of these support groups talking about brain injury and the recovery process, how important it is to have support, things like that, right?
And people need to know, the general public has no idea what the brain injured go through from the beginning all the way through therapy. And those of us who are lucky enough to be survivors we need support. And I made this book through notes that I kept during my recuperation. My neuropsychologist suggested to help me organize my thoughts that I keep notes, and I kept notes for almost 20 years. I had them interpreted from my brain injured level of thought to an adult level of thought, and then I reinterpreted them to me, and I created it into my story, and I'm really hoping that my story will help other head injured, give them confidence and motivation, help families.
I'm interested it will, but it already has, you know, and I know that you speak in a lot of the support groups and things like that, and I know actually I've been starting to do the circuit and speaking to some of the support groups about chiropractic care. And I think it's just wonderful how you go through your experience and how you've recovered so well. It gives these people hope.
Thank you. I hope it does. Thank you.
Now, I know that we were talking a little bit earlier about how a lot of people that go through a brain injury or traumatic whiplash and things like that, they have emotional disturbances. They have fear of going in public, things like that. And so here I have a research article that was published in the Journal of Manipulative and Physiological Therapeutics about the effects of spinal manipulation, which is what a chiropractic adjustment is, on the intensity of emotional arousal in phobic subjects exposed to threat stimulus, a randomized controlled double-blind clinical trial. So this study was done at a community college using muscle testing and spinal segment that was found to be associated with emotional response. Students were then adjusted while exposed to a fearful stimulus. It was found that the adjustments reduced the level of anxiety. Each student's heart rate and report of fear was taken before, during, and after viewing the phobogenic stimulus. So basically they checked their vital signs, checked heart rate, their respiratory rate, their blood pressure, things like that, while they were exposed to these fearful stimulus, especially they were specific to those particular people. The people that were afraid of spiders used spiders, or whatever they were afraid of, right? And they also documented their level subjectively of how it made that person feel. So spinal adjustments were performed while the student was experiencing the fearful thing. After the chiropractic adjustment, the phobic test was performed again. The researchers reported that spinal manipulation or chiropractic adjustments specifically and significantly decreased the intensity of emotional arousal reported by phobic subjects.
So maybe if I had known and come to you earlier on, I wouldn't have been so nervous around people. I might have learned quicker. It might have been easier.
Absolutely might help the recovery process. And I know that I take care of a fair amount of people that also have the same type of injuries, and also not just people from brain injuries, but we take care of a lot of people with developmental delays, developmental disorders, other phobias and fears and psychological disorders. And we actually, believe it or not, have a great result with those. Now, it's not that we cure or heal their manic depression or their ADD or any of these type of things, but if we can restore normal function in the nervous system, the body has a better ability to send normal impulses and to heal at a normal accelerated rate.
And if our bodies work better and more the way we want them to, I'm saying us, the brain injured, then we have more confidence.
Absolutely, and if you have more confidence, it makes it a lot easier to integrate and assimilate back into the public. Absolutely.
Thank you.
So I want to show one more video clip here about just showing a minor whiplash injury and how even just a minor whiplash, this is showing 6 miles an hour, how it can actually cause major damage to the ligaments in the cervical spine, the joints in the cervical spine, and actually the nervous system and the soft tissue. So here we go. It says slow motion, 6 miles an hour.
Wow.
At only 6 miles an hour, we're experiencing what actually can become major trauma. And it's, again, this is a big mistake I see so many people make, is they'll have even just a minor whiplash or trauma and won't think it's a big deal.
And I'll bet you these kind of things happen
every day.
all
every
the time,
day. Absolutely.
every day.
And they may not even necessarily feel a lot of pain, symptoms, or discomfort right away. And then what happens is, because it's out of alignment, over time, now it may be days, months, weeks, years, even decades later, where they start to experience the pain, the symptoms, the discomfort, or the trauma associated with that. So again, it's important to make sure to get our spines checked regularly and often, especially when we've had whiplashes or traumas like this.
And everybody has.
Absolutely.
Yeah.
Absolutely. So we're just about out of time, and I want to thank both of you guys for being here today. Dr. Kelly.
Thank you, Doc.
Thank you. And Lori.
Thank you.
We're really glad to have you guys both here. Thank you so much for joining us on Ask the Chiropractor. Again, I'm Dr. Adam Rodnick out of Commerce Township. I want to leave you with one thought. God gave us the gift of life, and what we do with that gift is our gift back to God. Thank you very much. We'll see you next time on Ask the Chiropractor.